And right now, though, I caught up with Dr. Burstein to find out, well, basically get the lowdown on whether we should get the flu vaccine and how it's going to work this year with COVID and all that stuff. So check this out. Should you get the flu vaccine? Dr. Gail Burstein, Erie County Commissioner of Health, joins us now to break it down.
We know that the flu can be very, very debilitating. People can get really, really sick. And we also know that people can get very, very sick from COVID-19. We also know that COVID-19 and flu are going to happen at the same time this year. So it's really important to be as protective as possible for your health. And since we don't have a COVID-19 vaccine yet, it's really important that everybody get a flu vaccine. And it's actually anybody who is over the age of 6 months can get a flu vaccine. There are very, very few contraindications. There are some groups of people that we're really, really important to get a flu vaccine. So that is young children, all people who are 50 and up, adults and children that have any type of chronic disease, and also people who are around those people that are very vulnerable need to get a flu vaccine. So that would include healthcare providers, parents, grandparents, because we need to be a cocoon and protect the vulnerable people around us. So if we don't get sick, then they don't get sick. And then people ask, well, when should I get a flu vaccine? Because they're being advertised now at all the pharmacies, and a lot of healthcare providers' offices have the flu vaccine. So, the thing is that we never really know exactly when the flu season is going to start every year. Every year it's different. So this year, the Centers for Disease Control and Prevention is recommending that everybody get a flu vaccine before the end of October. And if you don't make it by the end of October, it's never too late. There's always another chance. Also, we just want to remind people to continue with your protective measures against COVID-19, because that will also protect you against influenza. We know that in the Southern Hemisphere, where they've had their influenza season already, they actually had a very low number of influenza cases compared to other years, because they were masking and social distancing and washing their hands. So that not only prevents COVID-19, it also prevents influenza. And then, people have believe these myths that they hear on social media about, the flu vaccine causing influenza. But it's actually biologically impossible for the influenza vaccine to cause influenza. The problem is timing, because usually the time when people get an influenza vaccine is the time when you start to see, respiratory viruses circulate in the community. So by coincidence, you might develop a cold or some type of upper respiratory tract infection very soon after you get an influenza vaccine, but that doesn't mean that there is a cause and effect relationship. Also people say I don't like needles, and there's actually the nose spray flu vaccine is available this year, and CDC said that is okay to get this year. So just talk to your healthcare provider, your pharmacist, and they will find a vaccine that is right for you.